Let's explore HST case coordination, the fastest way to coordinate surgeries and communicate inside and outside of your ASC. Optimizing OR block time is essential for maximizing revenue, and that's where HST case coordination helps ASCs avoid revenue loss and ongoing overhead costs for unused time slots. Increase your case volume and revenue growth with our broadcast feature, so physicians can easily see all available times, making it easier to fill open time slots. With our HIPAA-compliant instant messaging tool, Chat, you can communicate on cases in real time with ease among your internal staff and external vendors. What's more, your ASC can save time by automating scheduling and eliminating unnecessary back and forth communications, allowing your team to focus on what truly matters, patient care. With HST case coordination, improve staff efficiency, communicate faster, and grow your center. Let's dive in and see how it works.
And we're going to start with a surgery center user where you'll land on the home page you can see here on the screen to have access to your entire case schedule. You have the capability of viewing or printing your schedule in multiple different ways by filtering or sorting your case list to fit your preferences, as well as accessing different dates or date ranges for cases in the future, as shown here. You might be wondering, how do cases get into case coordination? Ideally, cases will originate from your physician practices, which will show up here underneath the proposed section, which we'll go into further detail later on in the video. However, there is also the capability for your facility scheduler to add cases themselves, in which all case information will flow into the other HST products for your team to continue their workflow. Next, we're going to click on the OR scheduler, which displays your daily schedule by OR to visually show upcoming cases and block times at your facility. This is not only where you can view your case schedule, but you can also use the OR scheduler to set up all physicians' recurring block times to ultimately streamline the scheduling process and create transparency to the surrounding offices. If you click on the recurring block time view, this will take you directly to your recurring block schedule where your staff can efficiently manage blocks from one screen by day, week, or month. If you click Add Block Time, you can provide all the physician details and ensure physician blocks are following the correct scheduled behavior, which can replace outdated spreadsheets and Word documents. Click Create Block Time right down here, and you'll see it populate in real time on the OR scheduler. You can alter blocks directly from this screen. If you click on a physician's block, you'll be presented with options to edit, release, or delete, which will be updated in real time to create transparency for your physician practices. One of the key benefits of managing block time and case coordination is sharing open availability with your offices. By creating an automated block schedule for each physician, the facility can provide instantaneous communication and transparency with all surrounding practices in a HIPAA-compliant way, urging them to book more cases electronically within their assigned block. Ultimately, this provides physician practices with an easier scheduling experience, which can result in a higher % of cases being scheduled at your facility versus another. Before case coordination, physician practices had no visibility into the open time slots for the facilities they operate at, let alone their own block time. Now facilities can grant different levels of visibility permission to each of their physician practices to allow them to automatically see the real-time open availability. I will share with the physician practices here shortly. Lastly, the OR scheduler view will also allow you to utilize the broadcast feature, where the system automatically gathers all unused OR time and announces via email notification to the specified physician practices that certain dates or rooms have space to book more cases. This will allow the physician office scheduler to secure additional time directly through the email notification. Our broadcast tool not only increases case volume to the facility, but it will also increase efficiency as most centers are currently manually compiling all unused OR time weekly or monthly and communicating it via fax, email, phone to each individual office on a weekly or monthly basis. Now, case coordination can do that for you. Now I've switched over to show you case coordination from a physician office scheduler's perspective. You'll notice that they have a very similar view as the facility. If you click into the OR viewer, this will allow the scheduler to seamlessly view their physician's blocks or other available time at the facility outside of their physician's blocks to book additional or last-minute cases. Important to note that the scheduler will not see any information on cases or block time for physicians that are not part of their practices. They will be presented with this grayed out area to signify that the time is not available. If I click into a blank space, this starts the case proposal process. The physician office scheduler has the option to schedule a case from scratch or schedule a repeat patient, which would copy all previous information. I will now choose a procedure template. Which fills in all procedure information automatically before it opens the electronic scheduling form. Now that we've jumped into the scheduling form, all the scheduler needs to do is jump straight down to provide the patient demographics before reviewing the case. Lastly, the scheduler can complete the coordination section to add necessary individuals to the case, i.e. other staff members of the practice, vendors, anesthesia. They can also use this section to upload patient documents, for example, H&P, physician orders, insurance card, ID, etc., rather than relying on the fax machine or sending an unsecure email. Now that the case is ready to go, we just need to select the submit case, and instantly the case is in your facility's queue for your scheduler to review and approve before officially placing on the schedule and have the information flow to the other HST products. I have now switched back to the facility view, where your scheduler can review and approve proposed cases from the office right from this tab. When the scheduler opens the case, they can review all info and make changes as necessary. If any information is missing or the case cannot be completed at your facility, the scheduler can send it back to the practice with a quick comment where the office can make the needed changes and resubmit the case. We can take a look at cases that have been officially scheduled. Facility users can jump into the case to access case details and many other valuable tabs. First, we will review the case details, which looks very similar to the information in facility's PM system. We also offer customizable case tags that show alongside a case, which facilities typically use for patient safety documentation or equipment needs. Next, we can review the Request tab. Think of requests as messages that allow anyone on the case team to easily communicate between one another about outstanding items needed before the case can be performed. Some common examples for requests include sending a message to a vendor rep about implants equipment needs, or sending messages to physician staff to let them know that you still need certain documentation. You'll think of more. Ultimately, minimize manual forms of communication such as emails, texts, phone calls to confirm information about a patient that can be done right from here. Next is the Team tab. Anybody that has a restricted privilege level must be added to the Team tab to see case details or receive notifications about case changes, cancellations, procedure changes, and so on. Lastly is the Documentation tab, where staff can securely upload or access all documentation for a patient. This section can be leveraged by anybody who has access to this case if they need to share a document safely, securely, and instantly. This does not apply to vendor reps. The case tags I mentioned earlier can be automatically added or removed if specific documentation types are added to the case. For example, an H&P needed case tag could be removed if the correct document is added. Soon, there will be an automated workflow that will help tie in documentation between all HST products. Now let's head over to the inbox. This is where individual users can manage and view their automated notifications that are HIPAA compliant, regarding important changes to their upcoming cases, such as time changes, cancellations, and so on. Users can customize their notification delivery method, whether it be text, email, or push notification for the mobile app, as well as the frequency that they are received, immediately, hourly, or daily. If that's too much work, no worries. The case coordination team has you covered. We've set up valuable default notifications for specific user types at your facility so they can receive certain notifications that are important to them. Moving on, we will look at the surgery board. So if we just go back to our case schedule, our electronic surgery boards serve as patient trackers on the day of surgery. With configurable columns, your facility can customize views for each area, OR, PACU, lobby, as many as you need, to keep everyone updated in the facility. Statuses can be updated with touchscreen monitors as well as directly through our mobile app. Lastly, with our HIPAA-compliant waiting room view, patients' families can stay updated on the status of their loved ones, which alleviates anxiety and improves patient satisfaction scores. Overall, our surgery boards are proven to reduce bottlenecking and move patients through the facility faster by 10 minutes on average, based on our award-winning mobile app. Our mobile app gives staff and offsite users, such as physicians, vendors, and anesthesia, easy convenience to access their schedule and make updates on the go. You can view your schedule in different formats, list, day, and month. The mobile app has similar capabilities as desktop. So if the user clicks into a case, they can easily access all case details, the team tab, documentation, and everything else. We even have a HIPAA-compliant chat tool to reference cases and stay connected with the care team regarding outstanding tasks. And there you have it. That is the overview of case coordination.